Let's talk about one of my favorite regenerative medicine products and aesthetics, Ariessence PDGF. PDGF stands for platelet derived growth factor. Why I love this product so much is it's really taking the spot of things like PRP and PRF, where in the past we used to have to do blood draws for. We take your blood, we concentrate it down, we extract the platelet rich plasma or the platelet rich fibrin out of there. Platelets are chock full of growth factors. Therefore, we inject these growth factors, these platelets, back into your face or use it topically after laser treatments to help stimulate cell growth like collagen, things like that. So what's great about PDGF is that now we don't need to do these blood draws to get this platelet derived growth factor. So science has just become very advanced. And what's happened is that they take the genetic coding in our cells that make PDGF and they insert that into other cells. In Ariessence PDGF case, that's going to be yeast cells. So you have these yeast cells in a laboratory that have genetic splicing with our code that pumps out bioidentical human platelet derived growth factor. So this would be the same thing that we're trying to concentrate from your blood. It's just made in a laboratory from a yeast cell. So now not only do we not have to go through the extra time, but the patient doesn't have to go through the pain of doing the blood draw to extract like PRP and PRF. We have purified platelet derived growth factor that comes from the lab that's identical to the ones that we'd be extracting from you and a nice little vial. So in that little vial, there are 4 billion growth factors. This is at minimum 1,000 times to up to 300,000 times more potent than anything I can extract from a human. So the thing with PRP and PRF is it's really the results that you get are heavily reliant upon the quality of growth factors and platelets that you're getting from that individual patient. That's why sometimes with PRP, PRF, that I would get amazing results, and other times maybe not the best because the quality of their blood is not the same. What you get from a healthy 25-year-old male is not going to be the same quality as what you get from an older 65, 70-year-old female. It's not going to be the same quality of growth factors. So this just standardizes things because we know in every vial we're getting 4 billion platelet-derived growth factors and a little tube of Ariessence PDGF. So it standardizes the treatment and we get more consistent results. So who can benefit from Ariessence PDGF? Really almost anybody that's looking to regenerate cells, grow collagen, things of that nature. So some common treatments in aesthetic medicine in which I use PDGF can range from topical applications, such as when I'm doing microneedling, RF microneedling, or as an adjunct to ablative laser therapy, like when I'm using my ultra clear. And I also use it as an injectable as well. So it really can be used in any instance where you're trying to increase your results, increase collagen production, and decrease downtime. So with microneedling, we use it as a glide, and we're actually actively microneedling the growth factors into your skin as we're performing the treatment. This I've noticed significantly reduces downtime, almost takes away redness instantly, and increases the results, like as far as it helping with texture and fine lines and wrinkles. With RF microneedling, I am usually doing 2 passes, which I normally do in my RF microneedling treatments, and then I am applying the PDGF and the growth factors, so the growth factors to select areas, and then I'll do a third pass to really get it down into those little tiny holes that the RF microneedling creates, and then driving it down even further with a third pass. I've noticed that once again significantly decreases downtime and helps increase results. And there was actually a small study that was done showing specifically the Ariessence PDGF used in conjunction with RF microneedling, that when those two things were used together, the PDGF and RF microneedling, it gave almost 30 to 50% better results than if you would just do an RF microneedling by itself. So I love combining it with RF microneedling. And then when I'm using it as an adjunct to my ultra clear laser, or if you're using a different ablative laser out there, then you are performing the laser and you are applying the PDGF topically afterwards. It definitely helps decrease the downtime, and I've seen that it significantly increases the results with as far as skin texture tightening, decreases the risk of side effects such as hyperpigmentation. So you're simply applying that on afterwards because once again, your skin barrier is open. You have all this micro trauma and trauma everywhere. That those growth factors are going down into that trauma and helping heal it and helping with cellular regeneration. Now, when I use it as an injectable. One area that I love using this in is specifically in the tear trough area. So you may want to have a conversation with your injector if you're wanting to maybe delete the filler and you're just wanting to focus on more regenerative medicine when you are looking to revolumize different areas on your face. You may want to delete the filler first before you switch over to the regenerative medicine, because sometimes it can increase the risk of certain complications. I have also use PDGF in conjunction with Sculptra and with Renuva. These are other regenerative medicine injectables. Sculptra helps with volume loss, so it helps replenish volume in the face, specifically collagen. So Renuva is an alternative for a fat transfer. So it helps you regrow youthful fatty tissue, such as the deep medial cheek fat pads. We tend to lose those and they shift down as we get older. And that's why a lot of people notice the hollowing there and they lose that support in the tear trough. So I love using PDGF in combination with Renuva. I have done PDGF in the tear troughs in the same day as I've injected Renuva in the mid face. I feel like they work together really well, almost synergistically. And I've actually even mixed Renuva and PDGF and used it in the mid face and under the eyes prior to injecting. It just depends on the patient. I have used PDGF and Sculptra within the same day as well, specifically using the PDGF under the eyes and then using Sculptra elsewhere, such as the temples, mid face, jawline. And again, they work really beautifully together. And I actually see better results when I've used them together than separately. It just kind of ignites our body to say, hey, we got to get working here. We got to regenerate some tissue. So I do see better results when I've used them together than separately. So how often you need to have PDGF treatments done really depends on the individual. When I'm using it topically, I'm using it in conjunction with the microneedling treatment, which is usually every 4 to 6 weeks, with the RF microneedling treatment, which is usually every 4 to 6 weeks, with a resurfacing laser. I mean, a lot of times that's just being done once for many people. So you're just using it at the time of that procedure. Now, when I'm using it for tear trough rejuvenation, typically people need 1 to 3 treatments separated by 8 weeks apart. If I'm using it in combination with Renuva, I'm typically injecting Renuva every 3 to 6 months. So if I'm mixing it with Renuva, I will just use it when I do the Renuva treatment. So every 3 to 6 months. If I'm not mixing it, I'm doing separately, like let's say I'm doing the tear trough with PDGF, but the mid face with Renuva, then I'm doing the tear trough every 8 weeks, but I'm sticking with every 3 to 6 months for the Renuva. Same thing with Sculptra. I don't mix Sculptra and PDGF together. Not comfortable with that just yet. But when I do use it with Sculptra, I'm typically using Sculptra separately in different areas of the face and using PDGF in the tear trough. So I'll do the Sculptra every 4 to 6 weeks, but I'll stick with using the PDGF every 8 weeks. Sometimes 12 weeks. So we love using PDGF at Bijoux. We get awesome results. Our patients love it with very minimal side effects. As I said, the biggest complication I've had is maybe just some prolonged swelling for 2 to 3 weeks, but it really does give amazing results, and it just helps make the results from other procedures that we're doing even better. So if you have any questions or interested in it, please don't be a stranger, reach out.